Welcome, everyone. Thank you for joining us today. We are going to just start off with brief introductions, the presenters. So my name is Katie Knutson. I use she, her pronouns, and I work at Clackamas County Public Health and am a program planner in our substance use and overdose prevention program. And I will let Michelle and Elizabeth do an introduction as well.
Hi, I'm Michelle Plutniak. My pronouns are she, her. I work with Northwest Family Services in the Vibrant Future Coalition as the Prevention and Policy Coordinator. I'll pass it to Elizabeth.
Thank you. My name is Elizabeth Smith. I am the Training and Education Coordinator for Oxford House in Oregon. You have to excuse me. I'm dealing with a little bit of a sinus infection right now, so I sound entertaining. I am also a outreach worker for Deschutes and Multnomah County for Oxford House. I have been in recovery since March 8th, 2010. March 7th, 2010 was the last time that Naloxone was used to save my life. It is a huge part of my story. I actually had Naloxone save my life 8 times in the last year plus that I was using. So I really appreciate you all being on here. It was community partners, random people that happened to save my life multiple times. So thank you for being here.
Thank you so much for sharing your story, Elizabeth. And thank you all for joining us. This is such an important topic to talk about and education to provide in the community. And, before I jump into my part of the presentation, I just want to, kind of give hold space for people that there are, there's some heavy content that I'm going to share. So please take care of yourself. If you feel overwhelmed, it's okay to take a breather, but take care of yourself. And we look forward to doing this training today. So go ahead, Michelle, to the first slide. So to kind of tee us off today, I'm just going to introduce, maybe for some, and I'm sure many of you are familiar with this already, what fentanyl is. Fentanyl is part of a class of drugs called opioids. And Michelle will talk a little bit more about opioids later in the presentation. But fentanyl is a synthetic opioid that, has made a lot of headlines in the last couple of years because it has really been responsible for the large increase in overdoses that we are seeing in the community. And fentanyl can be found in many different forms. So there's an image on this slide of counterfeit pills or fake pills. And so basically, if a pill that looks like a prescription pill is purchased outside of a pharmacy, it is most likely a pill that contains fentanyl. Sometimes they also look like Xanax or a different type of prescription pill. But the important thing to know is that if it is not from a pharmacy or a doctor, it is most likely fake and probably contains fentanyl and oftentimes lethal amounts of fentanyl. So they can be very deadly. Fentanyl has no odor, no taste. It can come in any color because it also does come in powder form. We've seen a large increase in the amount of powder fentanyl being seized in the region. And so sometimes it comes in colors, but oftentimes it's white. And it is 50 times stronger than heroin and 100 times stronger than morphine. So you can see this graphic on the right here of the pencil, and the little white powder on the tip of the pencil is the amount of fentanyl that could potentially take somebody's life. So it is a very small amount that can be deadly. Next slide, please. So this slide is a slide from actually a year or two back. It's the most recent national data, I guess, in terms of just kind of showing the trends in overdose over the last couple of decades. And what you can see here is that between April of 2020 and April of 2021, the number of overdose deaths surpassed 6 digits. So they went above 100,000 for the first time ever in our history. And so, and in recent years, the numbers have been even higher. And really largely what we're seeing, so you can see this dark blue line at the bottom, is specifically the number of deaths from synthetic opioids like fentanyl. And that number surpassed 64,000, so it made up like 64% of all drug overdose deaths in 2021. And the light blue line is all opioids, and that so that number would include, deaths from heroin, from prescription opioids, from synthetic opioids like fentanyl, and that was accounted for roughly 75% of drug overdose deaths. And the scary thing too that we can see from this graph is that the deaths specifically from fentanyl was surpassed the number of all drug overdose deaths from all types of drugs in just 2016. So trends have really shifted. And I can say, in the recent years, in 2022, and what we're seeing so far in 2023 is that there just continues to be an increase in drug overdose deaths from fentanyl. Next slide, please. So now taking a look at Oregon specifically, so you can see in this graph this image on the left, this shows the the change in overdose fatalities across the United States. So the states that are in kind of the blue colors actually saw decreases, and then the states in that are orange and red saw increases. Oregon kind of falls somewhere in the middle. We saw 1.83% increase in all overdose deaths from October 2021 to October of 2022. And we're also seeing, from recent data from the National Survey on Drug Use and Health, that Oregon now ranks second in the country for all substance use disorders. And we specifically rank first in prescription opioid misuse and first in methamphetamine use. And then in terms of access to treatment, we are seventh in lack of access to treatment. So it's an improvement from the year before. We were first in the nation in terms of lack of access to treatment, which is not good. People who are needing treatment but not able to receive it. So things are improving, but still it is very difficult for people who need help to get that help. Next slide, please. This graph is showing, this is specific to Oregon, and it's showing the number of unintentional fentanyl overdose fatalities or deaths broken down by year and by age category, how we categorize the deaths. So you can see that for folks who are age 25 to 44, this is really the age group that has experienced the highest number of fatalities due to fentanyl, and 45 to 64-year-olds are right behind. But what you can see is that there has been a significant increase in fentanyl-related overdose deaths across every single age group. And even though the numbers, thankfully, are still pretty low for those who are, age 0 to 17, there's still been an increase, and that is something that we are very concerned about. We really want to make sure that education and prevention is being accessed by young people. Next slide, please. So this slide is showing even more local data. So this is specific to Clackamas County. And this shows the number of drug-induced fatalities for each year. And this is deaths from all drugs. So this isn't specific to fentanyl. But what you can see is a fairly significant increase in Clackamas County in terms of the number of overdose deaths, excuse me. And the 2022 number 96 is now final. And so we, for 2023, we're seeing similar numbers, slight increase, you know, in 2023 as well, but those numbers are not final yet, so we aren't able to share them. But yeah, so definitely seeing an upward trend continue. Next slide, please. So this graph is actually showing a breakdown of the drug-induced fatalities by the type of drug. And this is over, you know, the last like 5 years, so from 2018 to 2022. And these are rates, so percentages. And what you can see here is, you know, I guess I'll start with the good news. We're seeing the number or the rates of drug-induced fatalities for prescription opioids has gone down fairly significantly over the last 5 years, and that's excellent. You know, we're seeing safer prescribing by our medical providers, and that's really good news. And then heroin, deaths from heroin have also you know, been slightly decreasing as well. We're not seeing a whole lot of heroin anymore, and a lot of that is due to just the prevalence of fentanyl out in the illicit drug market. And because it is so much more potent, that's what a lot of people who use drugs are actually seeking out now, because you know, it is so addictive. And so we've seen a really large, significant increase in drug-induced fatalities due to fentanyl, and also meth. You know, is also right up there with fentanyl in being found in drug-induced fatalities. Next slide, please. So this slide is really just speaking to youth access. And, you know, so what we had seen before COVID was a lot of misuse of prescription drugs among youth and young adults. Specifically, those who are age 18 to 25 have, you know, the highest rate of misuse of prescription drugs. And oftentimes, you know, they would be able to access it from a family member's medicine cabinet, or, you know, someone that they know. And, you know, now as prescribing rates are going down with prescription opioids, that's just not how youth are accessing these drugs anymore. And the scary thing is that social media platforms like Snapchat are a really easy access point for youth. All they have to do is find somebody who is selling drugs and add them, you know, as a friend, and then use an emoji that's code for a certain type of drug, and you can see what those look like on the bottom right there. And you know, and so it's much easier now for youth to be able to access illicit substances. And a lot of times they might think that they're purchasing a Xanax or purchasing, you know, an Oxy. But if it's not coming from a pharmacy, it's most likely going to be a counterfeit pill. And that's really scary because we know that such a small amount can be lethal. And so it's really important, I guess, for people who work with youth, or if you are a parent of somebody who is a teenager or a young adult, to just really monitor what their social media activity looks like and kind of know what to look for. We have seen, you know, from our sheriff's office an increase in seizures of drugs that have, you know, been drug deals that have happened over social media platforms. So it's just really something I think to be aware of, and to really make sure to provide that education to young people that if you're trying to purchase something that's not from a pharmacy, it's probably going to have fentanyl in it. All right, next slide. Turn it over to you, Michelle.
Hi, for this portion of the presentation, we will do the Naloxone training. Elizabeth and I will cover what Naloxone is, myths and facts, laws and regulations, risk factors, signs of an overdose, and how to respond. Naloxone is a life-saving medication and can reverse overdoses caused by opioids and only opioids. If you look at this picture, it is naloxone in the nasal form. It also comes in other forms such as intramuscular, which is more of like an injection type of thing. Nasal is the easiest to administer, so that's why we talk about nasal naloxone. Opioids are commonly prescribed for pain after a surgery or an injury in the prescription form, but there also are illicit forms such as heroin, fentanyl, and other prescription forms include oxycodone and hydrocodone and morphine. Okay, we're gonna play a game called Myth or Fact, and feel free to either shout out the answer in like just come off mute and shout out the answer, or put it in the chat box. Okay, so our first question is, naloxone encourages drug use and discourages people who use drugs from seeking treatment. Do we think this is a myth or a fact? Feel free to just put what you think in the chat. Okay, this one is a myth because death keeps people from seeking treatment. Having naloxone administered and saving one's life can give a patient a second chance and have them consider treatment options they might not have previously considered. Our next one, my next question is, naloxone is another drug that can be abused. Do we think this is a myth or a fact? Please put your guess in the chat or come off mute. I'm seeing a myth. I'll give it a few more seconds. Another myth. Yes, this is a myth. Naloxone cannot be abused. It actually won't even do anything if you are not experiencing opioid-related overdose. I mean, opioid-related issues. It only works with opioids. It's safe and effective. In addition, it can't be taken before to avoid an overdose. Next question is, overdoses are more likely to happen in long-time users. Is this a myth or a fact? This is kind of a tricky one.
I saw a myth. Someone said myth. Any other guesses?
This one is actually a fact. And I said it was a tricky one because it's a little bit counterintuitive. Overdoses more often happen in long-term users with 5 to 10 years of experience. And this will explain the risk factors, and it'll kind of go into more detail and explain why that this is true later on. My next one is, naloxone can be given by the person who is experiencing the overdose, aka it can be self-administered. Is this a myth or a fact? In a myth. Alrighty, this one is a myth. During a drug overdose, an opioid user will no longer be conscious, so they will not be able to self-administer the medication. Myth or fact, naloxone is not safe for children, pregnant people, or animals. Myth or fact in the chat. Alrighty, this one is a myth. Naloxone will only work if a person has opioids in their system, and it is safe for pretty much anyone to use. Myth or fact, naloxone will not work if a person has overdosed on something other than an opioid. I think I've said this one a couple times, so I kind of gave it away. Yes, I'm seeing true in the chat. This is true because naloxone will only work to reverse the effects of an overdose related to opioids. Naloxone does not prevent death caused by other drugs such as alcohol, cocaine, or methamphetamine. Myth or fact, if you're using with someone and they start overdosing, you can call for help and you will not get arrested. Myth or fact? True. Fact. This one is a fact. The Good Samaritan overdose law protects you from being arrested from any drug-related charges. There's something else I wanted to add. Oh, so however, it does not protect you from unrelated charges such as child abuse, a DUI, or public intoxication. So if it's related to substance use and you're calling, you will be protected from any legal consequences. Myth or fact, some insurance providers cover the cost of naloxone. Fact, true. This one is true. Many health insurance providers cover the cost of naloxone. Such as OHP, they'll provide 4 doses per year. So that would be equivalent to like 2 kits, as we call it. Kits usually contain 2 doses. However, it's important to note that if you're seeking it through insurance, you have to state that it is for you. If you say you want to have it on hand for friends or family or people you work with, insurance will not cover it. So just keep that in mind if you're planning on going through insurance to say that you need the naloxone for yourself. Something exciting happened recently. Naloxone is now available over the counter. This makes it a lot more accessible and makes it so you do not have to receive a prescription from a doctor to receive naloxone. So you'd be getting it most likely without your insurance, but and it retails for about $45 to $50. I looked on GoodRx today. It's a if you don't know what it is, it's a way to get coupons for prescription drugs, and it's about $30 at Walgreens today. Myth or fact, you cannot overdose on fentanyl by touching it. Another tricky one. Myth. Alrighty, this one is tricky because of things we've been hearing in the media recently, and we really wanted to clear this up. Basically, the concentration of so one cannot overdose on fentanyl through routine contact with skin. An overdose can only happen through intravenous or other ways of exposure, like in your mouth, nostrils, etc. And this is because the concentrations of fentanyl required to cause an overdose by touching is not what we're seeing. It has to be even stronger than it is now. So that's not something we're seeing just by touching fentanyl or rendering aid to somebody who is experiencing an overdose. We're not seeing overdoses. Myth or fact, basic PPE is enough to keep basic PPE is enough to keep responders safe. Myth or fact? Being true. This one is true. Basic PPE is fully adequate to keep you safe when responding to an overdose, such as nitrile gloves, surgical masks, CPR face shields, and we recommend to wash your hands. Here. Okay, this is our last round of myth or fact. Feeling sick is a symptom of an opioid overdose. Is this a myth or a fact? Being true. This is another tricky one and kind of relates to what we were talking about earlier in terms of you can't overdose on fentanyl just by touching it. Basically, what we're seeing are symptoms of feeling sick, just different from, we'll talk about the symptoms of an actual overdose, but just feeling sick in general is not consistent with an opioid overdose and is consistent with anxiety or panic attacks. We are seeing instances of people, rightfully so, having a lot of anxiety around dealing with people who've experienced overdose in fear of keeping themselves safe as well. And we can talk about this one more later on because we do get a lot of questions here. Our very last one, myths about fentanyl are harmful. So are myths about fentanyl harmful? Myth or fact? Saw fact in the chat. Seeing another one. This is a fact because they perpetuate misinformation and cause people to delay care. For instance, somebody might be afraid to render aid because of misinformation they've heard about fentanyl. And it further stigmatizes people who use drugs. So that's our main concerns there, and that's why we really want to clear up some myths that we've been hearing about fentanyl. So next, we're going to dive into some laws and regulations for naloxone. The 2023 legislative session, we passed the opioid overdose prevention package, which includes protections for businesses, public building owners, and schools. So we already have the Good Samaritan overdose law, but this provides an extra layer of protection for business owners, schools, other people who might be administering naloxone. Fentanyl test strips were decriminalized. It allows first responders to leave behind naloxone. For instance, if they respond to a call and the person does not want to go with the first responder, they can leave behind naloxone. And it allows minors under 15 to receive substance use disorder treatment without parent permissions in certain situations. So that's a very situational cause of that. It's also important to be aware of regulations for providing naloxone to youth. We know that naloxone is safe and effective in children for known or suspected overdoses. Naloxone is administered the same way to youth and adults. However, the legal age of consent is 15. So you will need permission from a legal guardian before giving out naloxone to anyone under 15. And by giving out, I mean like physically handing somebody a kit with naloxone in it or providing naloxone, not administering naloxone in an emergency. You are protected in that instance. So if you see somebody and you don't know how old they are, if they look under 15 and you think they're having an overdose, don't hesitate to react and administer naloxone. Oregon law protects those who administer naloxone while acting in good faith from civil and criminal liability. So basically, unless you mean to cause harm, you won't be held responsible for any act while providing naloxone. So again, if you suspect someone's having an overdose, don't hesitate. Okay, we know a lot of people of different organizations are on today, so we wanted to talk about organizational procedures and policies for naloxone. Does your organization have policies and procedures for tracking and storing naloxone? Consider the following questions. Where will the naloxone be stored? Do you have emergency response instructions along with the kit? Who is the designated employee who will monitor naloxone expiration dates and replace the kit when necessary? So these are questions to ask yourself when considering a naloxone policy for your workplace. Documentation is another important factor. How will you document the event and to who? So by event, we mean an overdose in the workplace, or you responded to an overdose while working. So how would you document this and to who? Does your organization require incident reports? And we wanted to mention public health has a template they can provide for naloxone policy and procedure. So if you'd like one, let one of us know and we'll get you set up with that. Okay, I'm going to pass it on to Elizabeth. Thank you.
Thank you, Michelle. So as I said earlier, my name is Elizabeth Smith. I want to thank you all for being here. The only reason that I am not one of those statistics that Katie was speaking about is because of people in the community who trained themselves and were aware, and of the first responders who helped to save my life. So thank you all for being here. So first of all, some of the risk factors for people who have the potential to overdose is one of the first main ones is mixing drugs. So what we know from the data that we're seeing right now is that whether it is intentional or not, the majority of the drugs out there are mixed. There are lots of different drugs involved in each one that you're trying to use. Also, the fact is that there are a lot of people coming into treatment centers or detox that do have polysubstance abuse. So that is a very high factor. Another thing that we are seeing a lot of is people who have a reduced tolerance. Now, this could be because they have gone to a treatment center, they were incarcerated, or any other reason, time in recovery, things like that, that they have a lower tolerance and they are not expecting the reaction that they get from the amount that they use. New supply or changes in the quality. So this is something that is really an important factor with the fentanyl that we're seeing in everything, is that you cannot predict that one single pill, one of those blues that they showed a picture of, on average can have anywhere from 1.5 milligrams of fentanyl in it to some of the newest data is showing 3.7. So you can never predict what amount is going to be in there. And if you are changing who you are getting it from, can also be a huge risk factor for an overdose. Another one is having someone else inject you. That is not having control over how much is going into your body and not having time to react to it or to stop. One of the most risk factor is using alone. There are resources out there. There's a hotline, Never Use Alone, which is a number that you can call, or a website that you can go on and communicate with somebody, because using alone is the biggest thing. If you do not have somebody there with you, there is no way that they can help you in that overdose. Just like Michelle was saying, you cannot administer naloxone to yourself. Thank you. You planned ahead. How do you recognize an opioid overdose? So first of all, it is important to see that it might not happen right away. It is something that could happen anywhere from immediately to 1 to 3 hours after use. So it is very important to stay around people, make sure that people are safe. The signs of it are going to be things like a bluish color to the lips and or the fingernails. There's this slow, shallow breathing or this really disturbing gurgling sound, which is the body struggling to pull oxygen in or out. But the most obvious sign that most people see and the most common one is that they're unresponsive. You cannot wake them up. You cannot get them talking to you. Next slide. So this is so very important. Please remember that you need to make sure that you are safe. You do not give aid to somebody unless it is safe for you to do so. So always be aware of your surroundings. If you are not sure, call 911, give specifics that you can, and leave the situation. Back out and make sure that you're safe. Maybe it's securing yourself in your car and just watching for the paramedics to arrive, whatever it looks like. Make sure you are safe before you render aid to someone. Next slide. So how do you respond to the overdose? First thing is, someone might be absolutely unconscious. They may be having an overdose. They may not. You never know. So the first thing you're going to do is make sure that you're safe. And then the next thing that you do is you're going to try and wake them up. Okay. You can holler their name if you happen to know it, or you can holler, hey, you. You can absolutely say, if you do not answer me, I'm going to give you Narcan. People don't like that. If they can hear that, they're probably going to respond. Okay. But if you are unable to wake them up by hollering or get a response out of them, the best way to check to see if they're breathing is to put your cheek over their nose and mouth so you can feel if the oxygen's coming in or out, and you can see if their chest is rising or falling. The next step is always to please call 911. The best thing that you can say is that you have an unresponsive individual. With the amount of overdoses that have been happening, sometimes it is prioritized to go to that other call first. It is really, really important that you just say, I have an unresponsive individual. And then please put the phone down, leave it on speakerphone, but try to assist the person. The next step would be to administer the naloxone. So the best way to do this, the person is on their back, okay? Naloxone, nasal Narcan is going to be a liquid that you are spraying into their sinus cavities. So if they are on their side, it can possibly roll right out. So keep them on their back, tilt their head back slightly, insert it into either nostril, doesn't matter which one, and hit the plunger on it all the way. Now there's one single dose in each one. Okay, I want you to wait a second or two before you pull it out, so it gives that liquid a moment to kind of roll back in. It's going for mucous membranes. That's how it's absorbed. Next slide. The next one, if you are comfortable doing this, it is very important if the person is not breathing to be assisting in that, to try and give them those rescue breaths. So you want to check and see if their airway is clear. The best way that I like to explain this is if if you have a kid or a dog and they're chewing on something and you didn't give them something to eat, you do this finger sweep, right? You just scoop it out. So if you can turn their head to the side, use a finger or two and just scoop their mouth in case there happens to be anything in it, you're knocking it out rather than helping to force it down into the airway, okay? So make sure that they are on their back. You're going to tilt their head back, pinch their nose, and you're going to give them a breath. So it's one short breath about every 5 seconds. So what you're going to do is you're going to take a slow, deep breath in yourself, and then you're going to breathe for them for about 1 full second. You should see their chest rise and fall with this breath. And you're going to repeat that about every 5 seconds. But like I said, it's really kind of hard to count in that moment. So make sure you sit back and take a breath or two yourself so you're not hyperventilating. Also, if your kit or anything like that happens to have a CPR face shield, I really encourage that you use those. And if you do not have them, they are so cheap on Amazon. I have bought so many cases of them for about 50 cents a piece, and they're just little ones that fit on your keychain. What this does is, first of all, it creates a barrier so that while you're breathing oxygen in, nothing is coming out at you. It's a little bit of a safety fact. The other thing it does is it can help direct the flow of oxygen into the lungs versus down into the stomach. So please, if you need a resource for those, or if you even want me just to bring you one, let me know, reach out after this. So the next step, they used to say that if the person has not responded within 5 to 7 minutes, give them a second dose. Then they said 3 to 5 minutes. Now they say 2 to 3 minutes. It is taking so many doses to bring people out of it a lot of the time with the fentanyl and everything. So what I want you to do is continue breathing for the person. And if it's been 2 to 3 minutes, give them the second dose if the emergency services have not arrived yet. But this is really important. I want you all to hear this. If the person is breathing on their own, you do not need to administer the next dosage. So with a lot of the mixes and everything and the polysubstance abuse, a lot of the time people can still be unconscious. But if they're breathing on their own, you have reversed that opioid overdose, and you want to go on ahead and hold off on giving them any more. The first thing that we're seeing is a lot of people who are administered more, it can absolutely put them into extreme withdrawals. So if their body's breathing on their own, stop there. The other thing is large amounts. Sometimes we've been seeing things like heart problems or seizures. So if they're breathing, again, go on ahead and stop administering it to them. Some of the substances that are mixed into things, I'm sure you've all have heard of xylazine or tranq. It is a animal tranquilizer. It is not an opioid. So there is a good chance that they're still going to be unresponsive and unconscious if that is present. But if they're breathing, you reverse the opioid overdose. If they have not responded and you've given them a second dose, go on ahead and keep breathing for them. Again, wait 2 to 3 minutes and continue administering as many as you have on you until they are breathing on their own or paramedics arrive. Make sure that you please stay with them. If they happen to wake up, there's a very good chance that they do not want to go with the paramedics. And please make sure that it's important that you have yourself or somebody else stays with them, because they're going to know that they are extremely sick. They have been thrown into really, really strong withdrawals, and their body does not have the capacity to understand that they should not use again, or the fact that this is going to wear off. So I'm not sure if it's on another slide or not, so I'm going to reiterate this. The naloxone has a half-life, so how long it's going to last in your body, of about 30 to 80 minutes. The shortest opioid half-life is 4 to 5 hours. So that means the naloxone is going to wear off, and they could potentially slip back into the overdose. So please make sure that they have somebody with them. Next slide. When they're waking up, please explain to them what happened. This is exactly what we were just talking about. They're going to be upset. They're going to be confused. They're not going to understand what happened, and they're not going to understand that they should not immediately use more drugs, okay? Their brain does not understand that in that moment. Everything their body is telling them that they need to. Please explain to them that you gave them naloxone and what happened, and try and get them to get further assistance. One of the side effects is absolutely going to be withdrawal symptoms. It literally bumps all of those opioids off of the receptors. It doesn't negate them, though. It just removes them from the receptors so they cannot be effective. So the person could be experiencing headaches, body aches, nausea, vomiting. They might be aggressive because they don't know what to do with this immediate, overwhelming feeling. But it is really important to reiterate, these are going to wear off really, really quickly. Next slide. Again, this is what I already just said, but it's really important. So let's talk about it again. Tell the person, please do not use more drugs. I know that's really hard to say or understand, but explain to them the naloxone is going to wear off. The longest it stays in your system is 90 minutes. They're going to feel like they absolutely need to use drugs again, but that naloxone is going to dissipate, and immediately all of those drugs are flooding back onto the receptors. So it's so important to stay with them, make sure that they do not use and they do not possibly slip back into that overdose after it wears off. Next slide. That's the end of that. All right. Thank you so much. This is the time for questions.
Thanks, Elizabeth. Yeah, feel free to drop any questions in the chat, or come off mute. We'll hang around and, you know.
Yes, I am curious. I know when all this is happening, the person is in a pretty bad state of mind, and we're trying to help the person, the individual. When a person who has heart issues or seizures and stuff, at what point do you make that assessment, or do you want to interfere the process of helping, or what are your thoughts about that? With a person with a history of seizures, epilepsy, heart issues, and such.
Yeah, I'll start off and then let Elizabeth add in too, if you'd like, Elizabeth. So, as a bystander, I don't think, it's your responsibility, or that, you would necessarily be able to know if somebody has a heart condition, or, another underlying factor that could complicate the situation. But ultimately, giving naloxone could save their life in that moment if they're having an overdose. And so it's really critical that we do that. It's critical that we provide rescue breathing if you're comfortable and it's safe to do so. But to Elizabeth's point, it's really important to wait, if possible, for 1 to 3 minutes before giving more naloxone, and that will reduce the chance that somebody might have a complication from giving too much naloxone. And it's also very important, that's why the call 911 is the step right before giving naloxone. So if you make sure that that is the first thing you do, then EMS should be there shortly after, hopefully, and can handle more complex medical situations if something like that were to happen. Elizabeth, do you want to add anything else to that?
Absolutely. So I always tell people that it's always safe to roll those dice. Give them naloxone just to try. Even if it turns out that the person was having a heart attack, it's not going to affect that. Okay. The only part of your system it's going to work on is the opioid receptors. Okay. So the fact that, yes, they are seeing with large doses, they are seeing some heart problems or seizures, complications like that. That should not deter you from trying to give it to them. And I can tell you right now, I have a pronounced heart murmur and heart palpitations, and I've been given such large amounts of naloxone, and it did not cause any problems like that. Okay. What it's going to do is it's going to bump those opioids off the receptors and just sit in the receptors. Okay. So the majority of the time where there are complications or problems, I think it usually has to do, so I'm not a doctor, but I think that a lot of the time it has to do with removing the opioids so quickly from all of the circuits in the body, literally, that there's such quick, immediate withdrawals happening.
Right.
So never be afraid to give that first dose and to do that rescue breathing, but absolutely calling 911, making sure paramedics are on their way.
Yep.
Okay, thank you.
Yeah. And I would just finally add to that, our community paramedics and first responders are just seeing that and this is partially a really good thing, right? That people who are on the scene when an overdose happens are giving naloxone before EMS ever gets there, which is incredible. We're seeing that a lot more. But I think what also is happening a bit more often is just that it's a really scary situation. And if the person doesn't immediately wake up, people are giving, 2, 3, 4
Another dose.
doses really quickly. And that's really what we want to try to prevent. I mean, ultimately, we're still saving people's lives. So that's really excellent. But it's really important if you can to try to wait kind of that 1 to 3 minutes before giving a second dose. And then hopefully first responders will be there shortly after. So.
Thank you.
Any other questions from the group?
If there aren't any questions right now, I want to talk about something amazing that I saw last night, if that's all right. I went to go get a prescription filled at the Fred Meyer's Johnson Creek in 82nd, which we know is a pretty rough area. And they had the new Narcan just right on the counter there in the pharmacy, and the bags that they handed out, on the front of the bag that my prescription was in, it says naloxone saves lives. And the back of it had those 3 steps about calling 911, administering it, and the rescue breathing. And I just think that's absolutely amazing. I'm so excited about that. And the pharmacist that I spoke to, she said they get multiple doses stolen every day. And she said, people ask me all the time, doesn't that make you mad? And she's like, no, obviously they need it more than we do. I just keep restocking. So I think that's beautiful that we have come to a point where we're starting to make this accessible to the public and that people are able to get it.
I have a story, it's short, and I recently went to the convention center for the public employees conference, and I had to park my car on Central Station because I had to take the train, the MAX. And so on my way in, which was 7 o'clock in the morning, it was fine. On my way back, it was a little bit of a story because this guy, I was waiting for the MAX, and this has to do with how easy and how available it is open right there at the MAX station. And also when I got on the train, and so you can see my look, Hispanic, short and such. So he first started in English, but then since he saw me, then he tried to speak Spanish very, very hard. And so I was following, and he goes and he called it Fenta or Fanta. And so we in Spanish, we have a drink which is called Fanta. So I thought it was the Fanta, the orange drink. And finally he opens this little container and he offered me for $20, then for $10. Finally, he said, just give me $5. It's a Fanta. He tries Spanish so hard. And finally, I talked to him, of course, in Spanish, because he was conveying to me in Spanish. We could have talked in English. I don't have a problem doing that. But because he thought he was getting kind of the deal, the offering, the buying, so easy and so available. So finally, I told him that he needed to get off by Emmanuel, and I needed to get off by 122nd and Division. So that's where I left my car. And so when he got off, he said that he's going to Emmanuel, and he has a lot of buyers there, and he can easily get it for $5. And he was offering me for $5. So I told him my son works at Emmanuel. He's on the 8th floor with the Randalls. He's a nurse. And so he said, oh, your son is a nurse? And I said, yes. Oh, okay. I have to get off. I have to get off. So he got off quickly from the train on that area, North Portland. And then I left. But to me, the message was, gosh, if they even talk in your language, number one. Number two, they don't care how much you give it to them. Even if it's $5, they'll take it. And they have a whole bunch. They have blue, they have orange. He showed me all kinds. I didn't know which quality it is. Of course, I don't know, but they showed me a whole bunch. And so I thought I should share. That's
Thank
all.
you for thank you for sharing that. So, yeah, I've heard that it is as cheap sometimes as, you know, $3 for a pill. I mean, it is really easy to purchase and very cheap. So yeah, it's scary. Well, I see we're at time, and I just want to thank everyone for joining us today. And we will send out the recording afterwards. We also have a short video that might be helpful if you want to just kind of see it again, you know, the steps of responding to an overdose. If you have questions, please feel free to reach out to us. We can, all three of us, drop our emails in the chat so that if you want to reach out, you can. And I hope everyone has a lovely rest of the day.
And don't forget to reach out if you would like an organizational policy template. Katie is your person for that.
Yep. And if you need access to Naloxone as well, I will include that link to request Naloxone in the email that goes out. Great. Well, thanks, everyone.
Thank you.